Namaskar, I'm Ashok Vyas, and today we are starting a wonderful new show, Healthy You and AAPI. And the vision behind this show and what we are going to be accomplishing in terms of moving towards healthy lifestyles, we learn from our guest, Dr. Anupama Gutti Mukula, who is president of AAPI. So let me have the pleasure of welcoming Anupama ji. Namaste.
Namaste, Ashok ji.
You are a pediatric anesthesiologist and becoming a part of AAPI as well as leading this important organization. Share how important it is for you to work with AAPI to give back to the community.
Yeah, it's a great opportunity for being president of a very renowned organization like AAPI. AAPI is American Association of Physicians of Indian origin, and we are almost nearly 4 decades old now. So I'm the fourth woman president in the 40 years of AAPI, and it's a privilege and honor to lead this organization, which is the voice of all the Indian American physicians in United States.
And as AAPI president, probably while you were in the offing, there were some dreams or vision that as a leader of AAPI, probably there is something that you want to do for the community. Talk to us about that.
Yes, definitely. So since I have been in the leadership role in my local chapter, where I served as president of Texas Indo-American Physician Society, the motivation to do something has always been there. There is some fire inside. So the most important things, what I wanted becoming a president of this organization, before I thought of this organization, is this organization has very much potential, and we are almost very prominent in very deeply rooted in this country. So the 1 in every 7 patients is being managed by an Indian physician, and a lot of Indian American physicians serve on the several academic roles, leadership roles in the organized medicine, like serving the presidents of county medical societies or other leaderships, chairman of programs and academic programs and research and all. So the reason why it motivated me to become a president of AAPI is my goals are mostly charitable activities, community related activities. And so this year we have started some good activities like blood donation drives nationally. So we know how pandemic has affected our lives and how blood banks are so dry. So these are some of the activities which always rotate in my mind, like we have to do some charitable activities. The second thing, AAPI as a leader, we are going in the mainstream, like how well we are connected to the American Medical Association or any state medical societies. If we served on the leadership boards in the local societies, I think we bring some value to our organization. So it's a mutual thing, like we learn from the local organizations versus Indian American organization. There is some difference because we are the ethnic physicians in this country. So what are the difficulties we face? Sometimes we face some racial discriminations. We may have personally experienced those. So as a voice, what can we do more? So these are the few things which driven me to go in the leadership role. The second thing is opportunities also has to come. So when there is an opportunity, I think it's always good to go when you have that qualities of a leader. So when people recognize you, you are a better person to go in this organization. So that kind of encouragement has been there for me as well locally. So which led me to go into the national leadership roles.
It's very encouraging to hear and inspiring also for some of our viewers. And there are some young Indian American doctors also listening to you. Looking at the way world has changed after the impact of COVID-19, it has affected our lives in multiple ways. Initially, there was very little knowledge about COVID. Many members we lost, including physicians and I would also recollect earlier someone who served AAPI as president, Dr. Ajay Lodha. Him also we lost due to COVID. Now share your memory of those initial days of COVID impact, and allow me to also share that my daughter, being a doctor, not from that expertise, but she was also called upon to duty. So I also recollect those days where physicians as well as their family members were full of fear. Your recollection of those early days, Dr. Anupama?
Right. So when COVID started in early January 2020, that's the time when the chaos started. And it started in New York, unfortunately. That was the area where it went up very drastically. And emergency ERs were flooded with patients, and not knowing what it was, why are they getting admitted in such big numbers, that created the panic among the physician communities. And a lot of physicians got COVID, and they have died actually with COVID, a lot of doctors and healthcare workers. There was no medication at that time, and the ERs were full, hospitals beds were full. There were no beds actually. The patients were almost lacking beds, so they have nowhere to go. And the ventilators, no ventilators. So there were a lot of issues finding a ventilator or lack of oxygen around the world. We have seen that in India, how lack of oxygen has killed. So and the COVID pandemics flared within no time. Within a month time, it was like all over the US. So situation worsened. Lack of masks, we did not have masks at that time, and infection was spreading. There was no adequate PPE, no supplies. So the country was not even prepared for a pandemic with emergency equipment or protective equipment for the physicians or healthcare workers. So we suffered that as a first step. Then came the lack of medications, what medications to use for these, what the diagnosis is not there. It's a multi-organ failure, and not knowing what exactly which organ to target. So those were the issues we had faced being physicians. And also many of our physicians were affected with COVID, so there was lack of healthcare workers in that scenario. So all these were experienced and readily experienced, with deaths climbing up, and there was no place to even handle the bodies, dead bodies at that time. So very pathetic situation we have seen last year in March, April, May 2020. After May, it came down. Again, it went up, the Delta wave came. But by the time we got the Delta wave, we were lucky that we had some vaccine available. So that was the second, the fastest improvement was development of a vaccine against this virus by Pfizer company, which was a life-saving thing. So we started doing vaccines. Initially, it was only given for healthcare workers, very old people who are living highly, who are very intolerant to these virus, immunocompromised patients or elderly people. So those were the ones we targeted the vaccine, and then it came. So we have seen every step of this pandemic, every phase of the pandemic, how we came from that situation where people were dying to a stabilization phase. The second wave, when the Delta wave came, again, we had enough vaccine available. Now the community was getting vaccine, including children from 5 years onwards now can get the vaccine. So that was a pretty good development in the science and medicine, great achievement. If your immunity is low, then you are more vulnerable. So when we protect ourselves, it's a physical barrier. We just need a physical barrier to protect ourselves from this virus getting into our nostrils. We breathe in the virus. It's mostly through airborne. So we can protect ourselves efficiently by wearing the mask. Even the mask also has to have good filtered mask. So it's a 3-ply mask. That's what we should wear. So the N95 mask or KN95 masks can filter 95% of the virus. That's why it's called N95. So 95% of the virus can be filtered if worn properly. So the mask has to be worn very nicely, snugging the nose and the mouth. So when you breathe in and breathe out, it can filter the virus. So it's not only you have to wear the mask to protect yourself, but you also protect the person next to you also. If both of you wear the mask, I think it's 100% protection against spreading the virus. So this is a common sense thing, and there is nothing wrong wearing a mask. It's not a social stigma, but you are protecting yourself. The pandemic is not yet gone. Now we are seeing Omicron, which is really highly infectious. The most infectious mutant strain is Omicron virus. And that's, you're seeing how rapidly it is escalating now in United States. Lakhs and lakhs of people are being infected now. But a simple protective device or a gear is a simple mask, a 3-ply mask. When worn properly, I think we all can get out of the pandemic. I think mask, mask, and mask, that's what we all say that everybody should wear. And let us finish the pandemic. Let's not extend the pandemic.
We hear global village pandemic kind of brought the whole world literally together in terms of facing the same enemy. And you have recently returned from India, participated in Global Health Summit. How do you see broadly the way India and America have worked to fight against COVID? Is there any significant difference that you have observed?
Mhm. Yeah, so it's all about wearing the mask, and also the second thing is the vaccine. So we have seen that vaccine is definitely protective against the COVID. So when the Delta wave hit India, they did not have fully vaccination done. So they only had the first dose. The second dose was still not yet given. So they had high number of deaths. So, but now India has progressed very efficiently in vaccination. So they have almost 60-70% are vaccinated with 2 doses, and they're ready to give the booster dose. So they are going, and then back mask. I've seen more people wearing mask in India versus here. What I noticed here in the city Hyderabad, where we did the Global Health Summit. So I think people are following the instructions, and they put a fine, but I don't think that will be stopping anyone. But if people are educated well, that this is the way you can protect yourself. I think education is very important. The media plays a very good role in educating the communities. So media has a very high role now in the pandemic times. You are the best ones to reach the communities. So we are asking the media people, just spread out the good thing, not to panic, wear masks and get vaccine. And the booster doses in United States, we are doing well with the booster doses versus other countries. But boosters are definitely good. We have high antibody levels. In spite of our travel to India, all of us were safe and we returned safely. I think we depend on the booster dose, and we were all wearing the masks. This is what I can quote, that these two are very important to protect yourself, and you can still lead your life normally.
I think your presence is really very, very helpful with us here at ITV Gold, also in helping people understand why vaccine should be the way to go. Yet we see here as well as in India, some people are apprehensive, and there have been some people very openly questioning about their freedom and why they have to take vaccine. So, uh, if you explain how vaccine helps and creates that protective shield, and also, what is the difference between the first vaccine, second vaccine, and the booster? How booster has something added to it? Because the word itself says that there is more power to the booster.
Right, you are so right, Ashokji. So we have seen that vaccine, it's a short lived. The antibody levels are dropping after 5-6 months. So this vaccine has to be given every 5 to 6 months. So Pfizer has approved now for 5 months. Now after 5 months you can take the booster, and once you take the booster, the antibody levels go up again. So the lifetime is only 5 months. So after 5 months again we have to get another booster. So right now we were perfectly. We had the booster dose in month of October, November, or December, and all the delegates who traveled, we said that booster is a must for you all to travel. So we all followed that, and then we all performed well there. We did well. So I think booster doses are important now. If you have already had one dose, second dose, third dose, and the hospitalization rate is high among unvaccinated people. That one more strong reason why we need to get the vaccine. So if you see number of hospitalizations, young people are getting more admitted and unvaccinated are more, even more admitted. 60-70% in the hospital right now are unvaccinated people. When the Delta wave hit, that time 97% of hospital admissions were unvaccinated. That clearly shows that how vaccine is helping us, protecting us. So why fear? Why hesitancy to get a vaccine? There is no need to get a hesitancy. So I think there is, it's a myth that vaccine is not helping. It's not a myth. It's a fact that everyone should get vaccine unless they have any medical contraindication, something, but other like allergic reaction to the vaccine. Those are the exceptional ones, and they should wear mask always when they go out. That's the only way they can protect. But in America, 30% or 35% are unvaccinated. Why? They're anti-vaccine. But the truth is, we should know that vaccine is protecting against this particular SARS-CoV-2 virus.
And especially now that we have these fresh data in front of us, as you mentioned, people who are not vaccinated, they got to be hospitalized, and they're more in the way of harm. And it is very painful to see how people suffer and we cannot save them. And AAPI has been on the forefront in extending help in addressing health related issues. Now that you came back from India, and there is some additional insight and information after this Global Health Summit, how do you foresee the role that AAPI is likely to play in fight against COVID, working with Indian organizations as well as here?
Mm-hmm. So API, we have done some COVID work in India. So we have, when the Delta wave hit, we raised some funds, and India was lacking in some oxygen plants and oxygen concentrators. We supplied those things when the COVID was rampant in India in March, April, May, Delta wave. Now India, they are doing very good, and they know most of the government hospitals have have oxygen plants now, so they are preparing well for the third wave. So the third wave is just starting right now in India with this Omicron, and a very few deaths though, but still they are more prepared now to face the third wave. So they're setting up oxygen plants in every hospital, government hospital. They have an excellent setup for COVID units. So they know after they face that worst Delta wave, they are better prepared for the third wave. The rate of vaccinations is going very good. India has given the highest number of vaccines than any others in the world right now. So that's a good progress by the Indian government. And we appreciate those efforts. And what can we do more from API to India during this COVID is, right now we are supplying them. We have raised some funds, $5 million. We spent almost 3 million. We have still about $2 million. What we are doing is, where are they lacking? What is that they need from us? We ask them, like, what do you need exactly to help yourself from another wave of COVID? So biochemical analyzers, those are the lab equipment where you can run 200 tests at a time, like in an hour, 200 tests. You can run all these COVID panel tests, everything. So those are the equipment we are able to supply now to the hospitals in need. Like these are the non-profit charitable hospitals. So we are doing our best to help wherever we can. even in the ICUs, if they need anything in the ICUs, then we are also, right now they are asking us help to have consultancy, like, can you do counseling, can you do free consulting? So our physicians are ready to volunteer to give their physician services to India.
I think things have changed, because earlier everybody was kind of, it looked like they were groping in the darkness trying to figure out how to proceed further. But now there is more clarity.
Mm-hmm.
And in this context, when we look at the overlap of different branches of medicine, so call
Mm-hmm.
that ancient or Ayurveda, and so developing strong immunity was the mantra that we heard quite frequently. And there were some suggestions from India that this might help, that might help. But let me request you to share, as far as modifying our lifestyle to stay safe from the impact of COVID, what would you say are the basic features which we should incorporate in our day-to-day life to stay safe?
Mm-hmm. Yeah, that's the most important thing for us to stay healthy, build your immunity. So the mask, external barriers are wearing masks, getting vaccine, and all these. But internally, to build your immunity, I think there is a need for changing your lifestyle. So how do we modify? How do we stay healthy? That's the important thing as an individual, right? So eat healthy, more plant-based food, and exercise, like go for a walk, 30 minutes brisk walk. So exercise keeps you healthy. And sleep, adequate sleep, everyone needs adequate sleep, like at least 6 hours of sleep. And also you have to have that social connectivity. So in this lockdown times, in this period of social distancing, I think mental health has become a worrisome issue now. So how can you reduce your stress? How can you build that social connectivity? So stay connected. We have smartphones now, we can connect through video chats, we can connect through Zoom. Now Zoom is a boon. Right now during the pandemic, we have seen how families are getting together, birthday parties or anything are going on the Zoom now. And so we have to have that kind of social connectivity to reduce your stress level. And also reduction is very important. How do you cope up with stress? Like, so read a book, or do meditation, do yoga, do other things. Like, so all these things are very much these are called 6 pillars of lifestyle medicine. These are the ways you can modify and improve your immunity as well as stay healthy.
When you said 6 pillars of healthy lifestyles, what can you repeat these 6 pillars?
So diet, healthy diet, eat more fruits and vegetables in your diet. The second thing is get adequate sleep, at least 6 to 8 hours of sleep. The third thing is exercise, walk, brisk walking every day. That's very important. The fourth one is stress management. Like, you have to cut down the stress. You have to have those methods, techniques, how you can cut down your stress, like yoga, meditation, and all those. And the other one is socially connected. So connect yourself to your family, to your friends, talk to your friend every day, talk to your family members, and stay connected. The sixth one is stay away from those unhealthy habits like smoking. Give up your smoking. Don't do alcohol, binging, drugs, recreational. All that stuff are bad for us. So they reduce the immunity, and they get you more prone to the virus pandemic. So these are the 6 pillars of lifestyle medicine, where you can improve your lifestyle, you can improve your health and stay healthy.
This is very, very important. I think worth repeating, and many times we hear, but we don't follow. And allow me to ask you, when you say 6 to 8 hours of sleep, then people sometimes they have quality sleep, sometimes they don't have quality sleep. And staying away from stress also is easier said than done. Sometimes it is a part of the situation or setting in which a person is passing through, and he will, okay, you are telling me, but what can I do about this, that, etc. So let us talk a little bit about quality of sleep. and what can be done to improve if someone after getting up they feel that I am still tired, or I'm not as fresh as I should be?
Yeah, the development of you need to get 6 hours of sleep. So in order to get that cycle, you can clock in, clock out your you can put a timer, like, so you want to go to bed at 9 p.m. or 10 p.m. Put the timer on, turn off everything, turn off your phone, turn off your TV, and everything, shut down your brain, and then go to bed and sleep. So that's how you have to develop certain discipline on your body. Once you have the discipline, I think your body also listens to you. So we need to have a control of our mind. So, and we have to have a control on our body. So you want 6 hours sleep, put a timer, and then wake up at that hour, like 5 a.m. or 6 a.m., whatever your timer is. So stay away from all the other things. Like, so those are the few things I think we have to establish. And also some slow soothing music also helps actually putting you to sleep. And don't put the TV on when you are going to sleep. The TV is the worst thing to have in the bedrooms. I think these are the few things, like how do you discipline your body and mind. Once you have the control of your mind, I think you can get adequate sleep. And also, we should not worry about tomorrow. What happens tomorrow is nothing to do. What you have done, achieved today, think about it, and then go to rest.
I think that's very, very important, and it is universally applicable.
Mhm.
While earlier you mentioned smartphone being a way to connect with others, now that also disconnects you with your sleep if you are not away from your smartphone before going to bed.
That's
So
what, after 9 p.m. or 10 p.m., turn off your phones, and then that's how you stay away. So if you are addicted to all these, I think that's where you lack your sleep hour. So you want adequate sleep, you want to gain that sleep bank, I think you should turn off your phones, and you disconnect yourself from the whole world. That is your time. Your body needs rest, your body needs sleep. So how do you get that 6 hours of sleep? So turn off the rest of the world. You should disconnect away from the world to get that amount of sleep for yourself. And sleep is restorative, like it restores your body energies. It restores what you lose during the daytime. So that's the time where the body is rested. Then the body is again repairing all the damage done during the whole day. That's the time you have to give to your body. Very important, sleep. My message to the community is we will overcome the pandemic sooner. And but for now, I think we need to protect ourselves and our family members who are immune deficient around us. Please wear the mask at this time. We are not yet out. So I think mask and get the vaccine. This is the message I want to give. Of course, hand sanitizers are always with you now. You carry with it. We are using buckets of hand sanitizer, but mask and vaccine are definitely a must for everybody. And this is the message from our physician organization to our beloved community.
wonderful. Working with community closely, and in that it is an extension, Healthy You and AAPI. Once again, thanks to you, and thanks to all our viewers for being a part of this conversation. And we'll again have more and more conversations that would help us stay healthy. So,
Thank
from
you.
this Healthy You and AAPI, once again, namaste.
Thank you. Namaste, Ashokji. Very nice.